time because I realize everybody's time is very valuable. My name is Betty Gardner, and I'm the CEO president of ProTrain, and we are the sponsor of the Continuing Education Training Institute, CETI for short. It's where business and education meet, where we work with school partners, we work with people like Danielle to get quality content, to work with our partners, whether it be an organization, a hospital, a business, a school, in order to be able to train and get certified qualified candidates so they can get a job. So today we're going to talk about the work experience to certification, meeting today's healthcare training needs. And I am very proud to say Danielle Sadighi is the Chief Marketing Officer for AMCA. She is my colleague, she is my friend, and we are going to go to the next slide and talk about some housekeeping. So really simple. This session is being recorded for you. If you're seeing this recording, you're either on it real time right now, or you signed up for the session. And as promised, we will be providing everybody that registered a copy of the presentation and links to the PDF in the recording. Everybody is automatically muted because you don't want to hear my cat coming in like I just had to throw him out of the room. Dogs barking, cats, doorbells ringing. But we do encourage you to put everything Q&A in chat, and everybody's voice will be listened to and questions will be answered. So use the Q&A and the chat at the bottom of your screen. Post to social media using our hashtag. How can we as educators in business and industry get the word out about learning from each other? Because that's what we are. The older we get, we have to learn from each other's experiences. One person cannot know everything. So that's why we take valuable knowledge and share it. Uh, of course, at no charge to you, because that's the value of the education that we feel is important. So use hashtag CETI 2025, and you're more than welcome at no charge to join our CETI alumni group on LinkedIn. That is a place year round where everyone that's on this webinar, you can share ideas and, oh, did you have this problem? How did that work? How did you solve it? Oh, I had a fantastic thing that happened that I'd like to share. That's the purpose of the education alumni group, for educators and businesses to come together. Thus, that's where business and education meet for CETI. Next slide. And many of you probably know Danielle. A few may know me, but as I said, Danielle is the Chief Marketing Officer for AMCA. She doesn't look it, but she has over 30 years of experience in the allied health industry. And she's co-owner of the American Medical Certification Association. Her background spans from career and technical education, CTE, post-secondary education, and she's been a school campus director and a marketing director. As we move through our lives, we have many different roles, and it seems like somehow there's a bigger plan than we can see at the time, where it brings all of our extensive experience together to make it work. And that's what we're here to do with each other, is to make it work. She contributes her expertise by serving on several proprietary school advisory boards. She participates in multiple state associations, helping to bridge the gap between education and certifications, helping people get jobs to better themselves, their family, their career. Danielle is always out on the road at some conference, speaking, presenting. She's done topics such as the value of certification, stackable credentials, digital badges. She's deeply passionate about marketing and branding with the healthcare education space. And that's one of the reasons that I'm attracted to Danielle, because she is passionate. You can feel that she genuinely cares about the industry and what she does. So with that, I give you Danielle Sadighi.
Wow, Betty, that was fantastic. And it is a privilege that, AMCA gets to work with ProTrain. And everything you said correct. We love working together, and I love seeing all the different. There's schools on this call. There's hospitals. There's people hiring, and as a team, like Betty said, we need to share information and collaborate and figure out how to work together, because I think everybody on this call is probably just as passionate as myself, and excited. Little shout out to NCI, my fellow Jerseyans. And the school they're at is one of the schools I started my career in certification, NCI. So very, very exciting that people can join. What Betty and I really thought that if we talk today a little bit about understanding today's healthcare workforce needs, which a lot of us all have knowledge, and I love interaction. So Betty's monitoring like the chat, like you said. Feel free to interact and say, wait, you have to add something. We're here to learn from each other. After we go over a little bit about the stats from the Bureau of Labor Statistics, we're going to touch on healthcare and certification pathways. Some of you might not know about work experience and how it could lead to certification. While it's a great option I'm going to talk about the alignment. More importantly, how we can bridge the gap between education, certification, and employment. Q&A should be the best part. Going to go over a little information, and then let's leave here with call to action. Not just have some information, but I would love it, right, Betty, at the end saying, hey, great, I want to contact you. There might be people on the call. Let's work together. So to go over, I'm sure many of you, if you're into the data like I am, it is staggering that as of yesterday, 19 million jobs for allied healthcare. Now, when you're saying that's healthcare, it's all occupations, but the Bureau of Labor Statistics states that from 2023 to 2033, 10 years, average 1.9 million job openings a year. Total that up, that's over 19 million jobs. We are all in the right area, and we need, as educators and a certification agency, we need to help fill those jobs. So every person that is attending one of your programs and every person that is getting certified by AMCA or one of the top other agencies, there's 5 accredited agencies that I'll talk about, they should be walking out with a job. But we need more because there's lots of openings. So what's the current challenge? So we love to do surveys and we love to talk to hospitals and the hiring organizations. And they're basically saying that their hiring challenges does have a lot to do with the skill gap. And the skills are what school programs like ProTrain, NCI, programs being run or being supported by certification, but then we want to talk on the job experience. So the staffing shortage is, as we all know, is due to retirement, burnout, increased demand. We're living longer, right? We're living longer, so we need to have more positions in nursing home or living home health aides. So you can see the demand. Employers are struggling to find candidates, not just to fill the seats, but they need people that are qualified to fill that role. And I'm going to talk about a very important exam blueprint that's going to help the schools and the employer identify how we're going to fill those skill gaps. And if you're on the call as a hiring body, agree you're having a hard time. The skills are mismatched from what your community needs. And we talk about that a lot. You need to know in your community what skills are the employers needing in your area. So those are the challenges that they're having, but we need to solve those because we have 19 million jobs to fill, right? So from medical assistants to billing encoders, employers have reported that that's harder than ever to hire people who are job ready, and that is with your skills. And the problem isn't finding the people, it's finding the people with the right skills. So everyone on this call, start thinking about how are we bridging the gap between education, certification, and the skills. So a little bit more about what employers expect. So we do this on surveys, do a lot of research. So what the employer is expecting, that if someone is certified, bottom line, that is a validation of skills. You guys have heard me say that over and over. That certification is a proof of competency. I've either taken a program at one of these great schools, ProTrain's got fantastic online schools that align. You take the program and you take an assessment. my skills are validated, so the employer that's hiring knows I have specific knowledge in areas like infection control or HIPAA, patient care. They know that I can bring to the table a certain level of skill, and then I can grow within. Then you can mold them, keep them forever. So they're expecting the certification to do that. We are going to talk about a new pathway from work experience to certification. Certified candidates are often, and I know that I think you guys know, can agree with me. When someone takes your program, they learn a lot of fantastic stuff, or if they have work experience, but that certification gives them more confidence. I can stand tall. I can walk in the room and confidently say, I know what the HIPAA rules are. I know what the different colors of test of the tubes and stuff. So they bring confidence. I love it that they bring accuracy. So a certification, the employer is expecting that that candidate is going to walk in more confident, but I love more accurate, less errors on the job. And the key thing that they're trying to, they need to make sure their workforce, they're work ready. So whether you take a training program or you have on-the-job training, get the certification that's going to lead them to more opportunities. So the employer knows, hey, this person is serious. They want to contribute to their community. They are ready to work. I know that some of you might disagree with this number that I'm about to say, but as of yesterday, from the Bureau of Labor Statistics, and in there is the link, I was shocked that they are stating that 95, not 10, not 20, not 30, 95.9% of healthcare practitioners, that is practitioners and technical workers, so it does encompass allied health, were required to have credentials. That's a license or a certification. So for certification, as many of you know, everyone will tell you, well, it's not required. It's not required. I hate to say this. Don't kid yourself. If you're training or you're an employer, you know that people, if their resume doesn't have a certification on it, then it's not getting read. So for the Bureau of Labor Statistics to promote that number, that just shows you that all of your program and all of the candidates, if we want to help meet today's job skill, bridge the gap and help fill these roles, they need a certification. So there are, and you know what? I'm fair. There are 5 accredited certification agencies in the United States. As long as your program is using one of the 5 accredited certifications, I applaud you. Of course, AMCA, I will promote the AMCA for their quality customer service and their prep material. That's all included. But keep in mind, if you want to contribute and you want your students to get jobs after your program or based on work experience, they need a certification. So I thought that number yesterday, usually it's somewhere in the 50-60%. It has escalated tremendous. So that's really good for the world of certification and for you guys that are already offering it. Very simply, I love this line: certification fills the gap between the classroom learning and real world expectations. It assures the employer that a candidate has met a national standard for competency. And I am going to go over the blueprint because you're probably wondering, well, how do we align? Who sets the standards? And just like your schools, if you're a school on the call, and I know that Betty's ProTrain's accredited by Middle States and NCI, I believe is COE, that it is important that the school is held to a higher standard, which means you have policies, procedures. So the candidates that are coming in know they're going to walk out with a quality certification or a degree. It is important that our certifications have a standard of competency. What I'd like to go over a little bit about, this was one of the main things for this webinar today was, many of you might not realize that there are multiple pathways to certification that supports the 95% of the jobs that are available that are requiring certification. There is other options. So the main option is going to one of your fantastic schools, take a training program, then you qualify for a national certification. But there's another option for AMCA. We call it option 3. any of the certification agencies you're working with have a work experience option. So if you're not working with AMCA, please contact me and we can discuss options. But most importantly, we have a pathway. If a candidate, so we need to bridge the gap. How are we helping the hospitals and the doctor's offices fill those jobs? 19 million job positions, 19 million. This is a great number. If you are an employer on the phone, on the call, on the webinar, and you have people that have started working at your employment and they have 1 or more years work experience within, I'm going to pick on phlebotomy, working as a phlebotomist but never got certified, they actually can come to the AMCA, and through our exam eligibility pathway, we verify their experience and they can take the test at home with live remote proctoring. Now, that is a fabulous option. I am going to talk about after this, though, really, it's best to have like a 3-prong approach we're going to end with: education, certification, and work experience. That is the best pathway, all three combined for employment. But people, sometimes if you need to start with 1 or more years work experience, a lot of times you might have medical assistants that you've trained, they're in a hospital, they'd like to move on. They want to get a stackable credential. I've been doing phlebotomy, I've been doing EKG. Well, with the experience, if they can prove 1 or more years, they can come back and get stackable credentials, earn more money, and now also less errors on the job. You've now created an employee for life. You don't want to keep retraining. So you really need to know that every certification agency has a pathway to certification, typically based on work experience. Every agency has their own requirements. Ours is 1 or more years of full-time work experience. So there can't be a gap. You can't work 1 month and then be off 2 months, and then it's a full year of work experience. They get approved, they can take the test at home, they can go to a test center. What's required? They basically fill out an application and they submit proof from the HR department and we verify it. So I'd love to see if you have questions on how we can help. Option 3, increase your enrollment. Some of these people, even though they have experience, still don't know a lot about test taking. So this slide, I'm hoping, generates lots of questions or thoughts on how we could collaborate together. So one thing that I wanted to bring up, because you're wondering, how do we all tie together? And I don't know, I'd love, Betty, if you can do a survey, we should have thought about this, is how many of you actually know how an exam is developed or anything about an exam blueprint? The blueprint for the test is what keeps the school, the certification agency, and the place of employment aligned to current job tasks, job roles. What do I, as a phlebotomist, need to do every day? So I like to discuss, I wanted to point this out because, one, every certification agency is required to have a blueprint for every exam program. For every certification program, you start with a blueprint. A blueprint is created, very extensive survey, and it's called a job task analysis. So how an exam is created: an exam is started with a job task analysis, which is a huge survey asking people currently in the field, what do they do every day? And they weight, how important, and so forth. All of this data that's collected, it does go to a team of psychometricians. They review it and they will determine what the competencies are per career. Then within that competency, what tasks the phlebotomist does on a daily routine to be competent in that, to be competent. So it's very important. They're public. Every company like AMCA, they're on our website. They're in it, their test site account. But the training providers, one, use the blueprint because they want to know, does their program align to our exam? The blueprint tells them everything. An employer wants to look at the blueprint and say, well, if I'm hiring someone that took an AMCA certification, are they testing on the competencies that our job requires, right? Throughout the country, even though there's a basic job test for a phlebotomist, once again, or a medical assistant, but in different areas, there's still the job role can change, could be a little different. So the blueprint will tell the school and the employer what we're validating. I would love to see if there's questions on a blueprint. The blueprint, the certification agencies have to be transparent. We want you to know, we want you to use this as a checklist. This is what we're learning, or hey, these employees that might have 1 or more years work experience, will they qualify? Will they pass the test? They literally will use the blueprint and look, oh, I'm doing this, I'm doing that, I'm not doing that. So it identifies maybe where they need additional training. Don't underestimate the value of the exam blueprint. That's going to keep all of us aligned. And bottom line, remember what we started with. The employers are having a lack of skills that align with the job. This tool right here that is free, and for every certification agency has their own blueprints. They conduct their own job task analysis, and that's how they construct their exam. So it's very easy for us to keep aligned and fill that skill gap. And all of us on the call, I'm sure, want to fill those 19 million jobs. What is our goal? Our goal is to have successful graduates, right? Who I want to be certification ready. We all want good pass rates, but bottom line, that graduate, we want them to be workforce ready, the right skills, and we want them to have a, future focused. So, I'd love to see if anyone needs more information about the construction of a blueprint to an exam, because it's important to keep us all aligned.
And so, Danielle, I did want to piggyback off of what you just said, because that slide was extremely important. And see, like I said earlier, we all can't do everything. One person cannot be an expert in everything. Danielle and her team, they are experts on aligning to the blueprint of what business and industry want, and what school partners need to trust in that you're working with an organization, a certifying body that takes it that seriously. And the school creates their program based on the blueprint and finds quality instructors in order to deliver that content. So therefore, business, industry, healthcare, they know that when they're hiring a person that has been certified by this certifying body, they know the skill sets that they were taught at the school that's an accredited school, and did not just make up their own curriculum fly by night and say, oh, this should prepare you to take AMCA or one of the other ones that, Danielle said there's others out there as well. But knowing if you are offering programs, you must align with organizations like AMCA, because they take what they do very seriously, because it takes a lifetime to build a reputation and a couple of screw ups to ruin it. And I can tell you, Danielle and I are not those people. We value our reputation and the quality of certification exams, the quality of training to either provide you the information to do it on your own. If you want to partner with someone that does it with several schools, you can explore us. We'll have our information on the last slide. No pressure. We're just providing information today, but this was a very important slide because we're all pieces of the pie. Nobody can be the whole pie. Danielle's a piece, we're a piece, you're a piece, the student definitely is a piece, and the employer. And the most important thing is for us to get quality training for that student so they can have a career pathway and support themselves and their family. This slide just speaks to me, Danielle. I'll go back on mute.
No, I think that was extremely important, which Mel wanted me to also bring up, that I love the fact that people don't know that a job task analysis that leads to the blueprint has to be done every 5 years. 5 years is a very short life in a career of a medical assistant or a phlebotomist. And I always wonder what other industry does that, where they're every 5 years conducting a new job task analysis per program to make sure the skills are aligned, right, Betty? I mean, it keeps the curriculum updated. So some of the 4-year degree policy, I always wonder how often do they update their curriculum? We're required to do this every 5 years, which is short.
Well, and what you say, and if there if there is anyone on our call, that's on the academic side, I say CE is the fun side where we offer certifications. We're the fun side. We keep up with stuff real time, and every 5 years means it's that serious because business and industry change that quickly. There are I have been exposed to on the academic side where a person says, well, I have a PhD in IT. I don't need to be certified. Yeah, you do, because you need to know what the students need to know when they get a job. Because if you're just teaching to, general topics, it's not teaching to what business and industry want to hire.
And as fast as things are changing, we have to stay current. It is. So yeah, no, I agree. I agree with this slide. I think it's extremely important. To talk a little bit about also what we wanted to do was talk about the role of on-the-job training, and how it is actually qualifying workers. And I know you could have start with people on the job and then go back to get some additional education. The additional education helps them prepare for the certification, but the on-the-job training gives them real world hands-on experience. So they do have, an externship or an internship. So employers, to help bridge that gap, really need to look at some of the people that are currently working with them, how they can use the on-the-job training, say, you know what, let's get you back to school. Let's take you back to some classes, some of these online classes available through ProTrain, get you certified, stackable credentials. It's a trio. It works to help bridge that gap. So on the job training is very vital, and it builds confidence, because I always find the people that have received on the job training, whether it be before training, during, or after, their confidence level is up. And it does, I know, once again, twice it talks about certified people and on the job training reduce turnover and errors on the job. And we all know turnovers kill all of us, whether you're a school or a hospital. The turnovers and the training, we want to minimize that. We want longevity, right? We want people that want to stay at a cultured environment and help them grow, help them be part of their families, and love it. Don't we all want to increase productivity? So the on-the-job training, if you're an employer on the call, think how you can partner with a school and say, great, let me provide. Every little bit counts. Doesn't have to be a year. If you have a year, you can qualify to take the test without training, but it's really all about the trio. So even the best certification programs can't replicate everyday workplace scenarios. And I think we all agree with that. They've got to be on there. They've got to be under the pressure, dealing with families that are going through difficult times. There is so much that on-the-job training does to support certification and education that absolutely bridges the gap and will bridge what our goal is, right? Fill the 19 million jobs, and we want to have quality people that are skilled and match. Like I was saying, to wrap things up, and I'd love to see questions, is I think from being in certification, and Victoria on the call can validate that I have been involved in certification since 1994. But a three-pronged approach is you will have the most success for our candidates, and aren't they all our students, right? We want to help them change jobs, move into a career, get educated, get certified, on the job training. Then they're going to have a nice career path ahead of them. So it is, they said it like yesterday, I did look at the numbers, that approximately 72.7% of healthcare practitioners and technical workers require on-the-job training. That number was much higher as well. I know a lot of students or candidates, people that'll volunteer so that they can get that, but now the jobs are requiring certification, education, and on-the-job training. So what do we want to do? We want, meeting the allied healthcare workforce needs isn't just about recruiting, it's about building career-ready professionals from day one. And that takes alignment with certification and ongoing support. I hope that we have some great questions, Betty, because like I said, we did this together as our own collaboration. If you want to reach AMCA, here's my phone number and email, and we'll send it out. You have questions about quality programs from ProTrain, their number and emails right there. But were there any questions?
Oh, absolutely. I've got a few for you. I have one here from, and again, if I mispronounce the name, I apologize, from Tines Garcia. I have a question regarding the certification renewal process.
Mhm.
I noticed that when comes time to renew, we're not provided with a new diploma or ID card unless we pay an additional fee.
Mhm.
Considering the cost of the renewal, I believe these items should be included, especially since other certifying organizations provide them at no extra charge. I just got another one, so it just jumped on me. Hold on. I believe these items should be included, especially since other certifying organizations provide them at no extra charge. This is my only concern, but I do feel it's an important one. I hope you'll consider revising this aspect of the renewal process in the future.
Sure, no, and you know what to add. So, after like over 30 years experience, and I do know all the other certification agencies, everyone's gone 100% digital, so that people just don't sometimes don't realize it. So we do provide AMCA personally. Every agency makes their own policy, and we provide 4 forms digitally because that's the way the world is going. So you have it on, you automatically get it on your phone, in your wallet, you get a printable wall cert included at no cost. The actual ID card and the actual wall certs, nobody walks around with them. They became novelty items, a thing of the past. Employers don't even ask for them. So that's why we've invested our dollars in the content. But I will absolutely, I love feedback, and that was a positive feedback. I love it, and I would love for her to email me.
Okay. We have another one from Latasha Hunter, and I think you'll have an answer for it, and I'd like to add on to it. But I've been working as a medical assistant for 12 years. I'd like to become certified. Describe the process of using her work experience, how she can do that, or do you recommend that she takes a short-term course to be prepared to do the exam? What are your thoughts on that, Danielle?
Absolutely. So that I'm glad it was two-pronged. So one, the process is actually not that hard. You go to amcaexams.com and you open an account, and you're going to apply through option 3. Option 3 has an application. You fill it out online. You submit proof of your employment. So how to prepare, make sure you have a letter from your employer stating your work experience. I would look at our blueprint first to make sure you're covering a high alignment of the tasks that you're looking to test in medical assistant, because what we're going to look for at AMCA to make sure that, yes, on the job training aligns with our blueprint, so that we don't want you to take a test and not be successful. You submit the application, and then you can test at home with live remote. Backing support, we do find a higher percentage, pass rate percentage with candidates. You've been out of school a long time. It's okay. You've got a lot of great knowledge, but I think going back to a program online, getting reinforced, and then taking the exam, that is a more positive approach for a more positive outcome.
I hope that helped, Latasha. We do have another question from Karen Masters. I have a question about the LPN certification. Have you heard any more about the talk that they want to require a math and a science credit prior to going into the program? Is this just in Pennsylvania or is it national? Has the governing body considered that this may preclude wonderful nurses who just obtained their GED or adults of the educational arena from getting enrolled, even though they may be successful without those courses, which are not currently required? Thanks.
Great question, Betty. As you know, and I apologize, I'm not medical. I'm marketing and sales, but I am much more an expert on everything under the nurse. So my world is allied health, medical assistant, phlebotomy, knowing the policies, procedures, and regulations in all 50 states. Betty, does ProTrain offer LPN that you have any guidance or answer to her question? Because if not, we could find somebody, but I know, I'm sorry, I don't have any knowledge of that.
Yeah, ProTrain does not offer the licensed practical nurse certification, but we could find the answer.
Yeah, so do we have her email address? I think we do, if we can highlight it.
Karen, I'm going to put mine and Danielle's email in the chat for you or anybody else that would like to email us directly. Does that work for everyone?
Yeah, because Betty and I, the whole reason we want to do these kind of events is we are a resource. We have a lot of information, and whether it pertains to me or not, even if you wanted one of my competitors' questions, give us, you shoot us an email and we will help find that answer for you.
And I'm
It's a great question.
putting yours in there right now. So anybody that wants to talk to us offline, you've got our contact information. We do have, let me go back up here to my little chats here to make sure I'm not leaving anybody out here. Uh, okay, so that was okay. Now we have, and if I murder your name, forgive me in advance, Tashalyn Morris. I have a question from ANI Learning Academy regarding the CMAC, which is 160 questions. The time span to take the exam is too short comparing to the PCTC exam, which is 144. So
Actually, it's a great question. So when I was talking about psychometricians earlier, so once the blueprint, the job task analysis created, and then a blueprint is created from the survey, it actually gets handed off. We work with Measure Learning. Every agency has their own team of psychometricians, and they do cut scores. And I actually forget what tool is used to create the time allotted, but it is a very the process is not done by us. It is done by a team of experts that truly know how long. But that feedback is welcome, and we have a prep material. Well, it's a prep material. I'd like you to email me that question because I could. While I can't change it because it's determined every 5 years with a new blueprint, how long you're allowed it to take the time by someone a lot smarter than me. They always like feedback, but I do agree. It should align. The patient care has more time than the medical assistant. And it has to do with the style of the questions, not to get involved, but the questions are written in either a more difficult or easier style, and that does have a lot of they take that into consideration when they're determining the length that you're allotted.
thank you, Danielle. And we do have some others. Patricia Murphy. In my area, it is nearly impossible for offices to accept students for on-the-job training. The community college and one other large program has established sites. Any suggestions?
A little more there's always volunteers. So if the community colleges have taken up the hospitals, you have clinics, you have nursing homes, broaden your areas in which you're thinking on the job. Then even thinking of your students can shadow home health aides. There's so many areas, with traveling nurses, just kind of broaden the scope. On the job training doesn't have to be in the hospitals. Just think if there's clinics and even physical therapy right now, there's physical therapy offices everywhere. Think of anywhere that job might take place, even as a role. So just expand where you're looking.
Mm-hmm. That's very good advice. I mean, when there's a need, when there's a problem, let your mind explore all possibilities. Don't always just go the tried and true way. Think of where else can I look? Because we do that constantly here at my organization. We do not always accept it's black or white. Well, let's go find the gray and find the answer.
Yeah, because the hospitals, and everyone knows this, they have, they've got big liabilities, big insurance. They have a lot more risk, whereas a smaller clinic or doctor's office might not.
And we have some other comments here from Tanessis Garcia. So I'm going to skip around and try to get all of that taken care of. She had a question for you before, where we talked about the diploma ID card additional fee. So her additional comment here is, I would like to express a concern regarding the certification renewal. I currently hold 3 certifications and recently paid $300 to renew them for a 2-year period. However, I was disappointed to learn the renewal fee does not include the updated cards or diplomas. Many employers request to see physical ID card as proof of active certification. And unfortunately, I lost 2 job opportunities because I wasn't able to provide one on the spot. Considering the high cost of renewal, I believe that updated cards and diplomas should be included in the renewal package as a standard practice with many other organizations. And I think you have addressed that part. My only
Yeah.
concern, but I feel is an important one, and I hope your organization will consider. And there's something else down here. I want to get all of Tanessa's. I lost 2 jobs not having the ID card. Okay. That's why I'm saying they should give ID cards, because it's not fair to pay so much money for 2 years. And that's all of Tanessa's right now.
No, yeah, definitely. And you can actually call me because I'd love to go through it. AMCA's renewal fee for 3 certifications is $158, then plus 15. So I know some of the others are up in the hundreds, 300s, and it is for 2 years, but the organization, if they said it was due to an ID card, I would personally call them for you, because ID cards are not a requirement. Like, everybody wants the official transcript. The hospital, once you actually get the job, they have to call AMCA and verify. There's a whole verification process that happens that an employer is required. They have to make sure that, just because you showed them an ID card, they don't take that for granted. Anybody can make an ID card off of a graphic program. I'm a graphic designer, so I know that. So I would love to challenge that place of employment, because ID cards are not, and actually, just the other 5, none of them, they're all for purchase. They're not included. NHA, NCCT, we all work together when we're making difficult decisions, and it has nothing to do with money as to what the employers want, because we want to help you. We don't want you to lose any opportunities. That's absolutely horrifying to hear that. We want to support you. So feel free. My number is 973-582-1800. I would like to call that employer to find out why they think an ID card validates your skills. The transcript validates your skills. You've achieved a certification.
And as
That's
you can
fair.
see, we're here to provide information to help you.
Yeah, definitely.
Well, we have Victoria, something you had said earlier. Yes, Danielle and AMCA have been great with helping on certification. Very knowledgeable. Having certification under your belt contributes to getting good paying jobs. So thank you, Victoria, for saying that.
Mhm.
And let's see here. Then we have Miss Morris from Jamaica. In Jamaica, it is mandatory to have the physical certification and ID card. Will AMCA consider adding pharmacy tech to their list?
Um, Thank you for that in Jamaica, because that's something for us to think about with the ID cards. But same thing goes back, that they can print the wall cert. No, we will not be considering pharmacy. Right now, it's all about the market, and CVS, Walgreens, your big players, they're very much accepting PTCB. And I know NHA has the accept that the way the market's changing, it's not an avenue we've chosen to go down. We're reinvesting. Everyone on the call, if you're part of AMCA, we're reinvesting well over $100,000 in all of our prep material. You'll start to seeing it roll out from now till the end of the year. It'll still all be free, but everyone chooses every year where to invest their dollars back in.
Mhm.
And we thought a smart idea this year was new exam question, new practice exams, new blueprints, more accurate data. So I'd love to, but now we won't be doing pharmacy.
Well, and I know Danielle and I have a meeting scheduled to talk
Mhm,
about all the updates.
mhm.
But I will say, if you are interested in pharmacy tech, we do offer that nationwide, and love to talk to you about it if you're
Mhm.
interested.
Yeah, it's a
Uh,
great market, great job opportunities. We just, we have our hands full with 11.
there's only so much you can do,
Yeah.
and we have Ariane, I know she had asked one other question. We are a university offering micro-credential short courses to students and professionals. Would this qualify already for taking the certification exam? We can offer our learners to take a certification exam on relevant micro-credentials for healthcare that we currently have. Also, do you accept application for testing area outside the United States, say in the Philippines?
Yes, we're actually, I am so proud. We are in all 50 states and 32 countries. So really goes back to the blueprint to answer your question. So for alignment, if our blueprint aligns to your curriculum, your students will pass the test. Betty, go back to the part one of the question.
Okay, no,
Sorry,
no problem. We are a university offering micro-credential
micro.
short courses to students and professionals. Would this qualify already for taking the certification exam?
Yeah, so actually micro credentials, and I know that some people might have to jump because I think we're over our time. So love these questions. Micro credentials, be careful. I sit on a lot of boards, and Institute for Credentialing Excellence is our accrediting body through NCCA, and even the organization that controls certification, micro credentials is a tricky word. A micro credential typically in AMCA's world is a certificate or within. So if I'm a medical assistant and I want to be an expert in bloodborne pathogens, that's a micro credential, or HIPAA or CPR. A certification really is for a career. I could be a medical assistant, I could be a phlebotomist. So just by going over micro credentials, but short-term programs don't determine whether you qualify. It goes right back to Betty, the blueprint, that no, very few states tell a school how many hours to run their program. They will not say, except New Jersey for medical assistants, it has to be 330 hours. 95% of them don't tell you. So even though it's a short term, look at your curriculum, see if it aligns with the blueprint. If your curriculum is covering the items on the blueprint, you're eligible for the test. I hope that answered the question. What do you feel about micro credentials, Betty? Right? Because there's always like a debate going back and forth.
Well, and I'll answer it. And I appreciate the people hanging in. Our high mark today on our webinar was, and I've been keeping count, 44. We still have 34, so you guys are hanging in there. Um, at ProTrain College, I mean, we offer courses. It's going to help you have a skill set like Word, Excel, etc. It's not going to get you a job. It'll help you do your job. We offer certificate programs, which is a bundle of programs that may not have a nationally recognized certification associated with it because the industry is not ready for that yet. But business and industry want people to have certain skill sets to get hired. Then we offer the certifications, which makes you have a nationally recognized body of knowledge where you are, can be job ready. A micro credential is where we're basically dividing up knowledge, little short bursts of knowledge, because some people don't have the time, and let's face it, some people don't have the money, or both, to go ahead and get the credential all at once. So micro credential, from our perspective, is where it's building blocks, stackable skills, if you will. And there's nothing wrong with that because and I don't know the age set of people on our call today. Younger people seem to tend to want to be able to get it quick, look at it on their phone. I've only got so many minutes in a day. As we mature and get older, we invest in ourselves a little bit more, and we might want to take a certificate or a certification, because I'm a firm believer in that not everybody needs to have a 2 or 4 year degree or further. Most people on this earth right now just want to get a job for pay to be able to take care of themselves and their family. So each one of those different learning formats, whether it be online self-paced, self-paced with a mentor, live online synchronous, in classroom, what I call button seat. We all try to deliver the opportunities for learning in the format of which the student learns best to be able to pass their exams if that's their goal to be able to get a job. Does that help, Danielle?
Yeah, no, I thought that was great because I agree when they're talking about the skill gaps and how to bridge them. Even if you're a medical assistant, like you said, go for that Excel course, take that micro credential. Those are stackable credentials. That's what makes you invaluable, earn more money, and look and stay on the job, career advancement. So micro credentials are definitely what the way you've worded it is absolutely the same way. Yeah,
Well,
modular.
and I think with the types of programs that you and I offer, Danielle, I know you specialize in healthcare. We have, a ton of other categories as well, but healthcare is one of our most popular. I would say healthcare, business, and IT are three top ones nationwide. But just because if you pigeonhole yourself into IT, don't you want to grow in your career, stackable career set? Wouldn't you maybe want to take some leadership programs after you get your feet wet? Management programs, project management. Same thing in healthcare. You may start out as an MA, MAA, phlebotomist, pharmacist tech, et cetera. But as you grow in your career and you mature as, a young adult into, middle age, you might want to think about what else can I add in my toolkit where I can be promoted. And maybe you might end up being the manager of a group of MAs, phlebotomists, pharmacy techs, medical admin assistants, things of that nature. So we need to encourage our population to not think about just now, but to plan for the future. And so many times, we talk with students, potential students, and they're thinking about right now, as they should. They need to think about right now, but they also don't need to be so closed-minded that they let me plan where I want to end up in my life and how I can reverse engineer that, taking classes that build upon each other to obtain my career goal. At least that's how I talk to my people. Think ahead.
And actually, to add in, both of us, both ProTrain and AMCA offer, and for everyone on the call, we offer financial literacy and essential soft skills. And
Hmm.
we're talking about bridging the gap of the right person for the job. Sometimes it's just those little short-term micro credentials, that'll help them get that job, move on. So people need to really, like you said, go online, look, take programs like that. But you and I have great resources to help them.
Yeah, and I'm typing to everybody. You folks are great. We will get you the recording and PDF because I think that concludes our questions at the moment. We'll get you the recording and PDF. Um, but personally, on behalf of Danielle, I think she did great. Let's all give her virtual high fives. She did fantastic. If you need us, you've got our contact information, emails, as well as phone numbers and websites. It's been my honor and my privilege to be your host, Danielle, on behalf of CETI and all of us. I think we learned a lot today.
Thank you for the opportunity. Everyone have a great day, and let's help people get jobs.
Okay, I appreciate it, and I am going to say thank you. Have a great rest of your week, and I'm going to leave the meeting.
Me too. Have a great day.
Bye bye.